Hello, everybody. Welcome again to the National Press Foundation. I want to welcome our keynote speaker, Debra Whitman. Please give a round for Debra, who is one of the, if not the best source in Washington on these issues. And so I'm going to start with just a few questions because I've sussed out some things that I hope you all will want to know. And then turn it over to you for questions. As all NPF events, feel free to interrupt, raise your hands. If you want to ask a question, if this is not a think tank, you do not have to wait until the end. And we will have a transcript afterwards. So I'm not going to read you Deb's resume because it'll take too long. But suffice it to say that she's what we call in Washington an innie and an outie, someone who's been in and out of government in every position, knows the town from top to bottom. So you've worked for the government, for the Senate Committee on Aging, you've worked for Congressional Research Service, you've worked for AARP, she's worked for Brookings. So she's seen the entire spectrum in this town of course, fierce partisans. Debra's also someone who's known as being able to, work across the aisle and talk to people from, all different points of view about this issue. So with that, I'll ask a few questions and then turn it over to you. But my first question is, tomorrow morning or tomorrow afternoon, you all are going to walk into AARP and you're going to say, oh my God, this building is massive. What do you guys do in here? So if you could just tell us a little bit about that.
Well, I thought it'd be helpful to tell you who I am and what I do, but I'm going to start with what I don't do. Because most of the things you've heard about AARP are the things that I don't do. So we are a nonprofit, nonpartisan. You will hear us say nonpartisan over and over and over again. It's really important and it's really hard. We can get into that later. Organization that tries to help people live their best lives. So you probably know us as a membership organization of over 30 million people over age 50, some under age 50. I don't do membership. We are a communications company. We have the most read magazine in the world. I don't know if any of you have written for AARP, the magazine or the bulletin. Our website gets millions of hits. We were a COVID communications company for several years. And really a trusted resource for older people and really all of America looking for things on COVID. I don't do communications. We are an advocacy powerhouse. I know you go to the Hill. We are famous for having probably the largest t-shirt budget in America because we put red shirts on our volunteers and we put them in the front row of everything that we do. I don't do advocacy. We have offices in all 50 states. We're nationwide, including in Puerto Rico. Hello, my friend. And I hope your family's doing okay there right now. I don't do our state offices. So you're like, wow, Deb, you got an easy job. You don't do any of the big stuff. What I do, and what I hope you guys will use me and my team for, is policy research and international. So let me just go into those a little bit. So my team helps to figure out where AARP stands on every issue. I have not memorized where exactly we stand on every issue. So in the Q&A section, give me a little grace. We have policy issues on literally thousands of things because we work on such a wide array. Everything from healthcare, long-term care, retirement security, to streets, sidewalks. We actually have policy on issues you would never even think that we would have policy on. That keeps us consistent across our organization and it keeps us forward-looking. What are our goals to have a society? So I'm really in the business of social change and trying to get us to where we want our policies to be. I also lead an awesome research team. So when you are writing a story and you want to know about something that deals with any of the topics that you're going to talk about in the next couple of days, you should check out our AARP research because we have surveyed somebody in the last few years about probably the topic that you want to write about, sometimes at the state level. And those are really rich resources. So right now, our survey is about voting in different areas. are really popping because there obviously is an election coming up. But we've done studies of grandparents. We've done studies of certainly older workers, almost everything you're going to be talking about. We've actually polled people. And let me be clear, we work with NORC. This is nationally representative data. It is as good as you can get. It is nonpartisan. We share the questions if you really want to see those as well. But really good data coming out. I also have the Public Policy Institute. You're going to see Lori Truinsky and Jen Schramm and a few other people, David John this week for my Public Policy Institute. These are some of the top experts in Washington on the issues we work for. So I've got PhD urban planners that think about how we should redesign cities and communities. I've got Social Security experts. I've got folks that can talk Medicare down into the weeds where I can't even get, and a whole variety of issues. So if you get nothing else out of this week, I want you to think of AARP as a source of unbiased, quality information and expertise. And that's my team. I also have a tiny team that does brain health, if anybody's interested. We work with researchers across the world to say, how can you reduce your risk factor for cognitive decline and dementia? I have a global thought leadership team where we look at importing good ideas from around the world. And I was just in New Zealand for 2 weeks studying that country and what they do with their older population. So I've got the fun job of AARP because I don't have to really talk to the 38 million people or talk to the White House and Capitol Hill. I get the thinking part, and I absolutely love it. I've been there for about a decade. But hopefully that orientates you into the org chart of the organization.
So now I'm going to ask the opposite question, which is, you guys do a million things. You've got expertise on a million issues. People in this room are headline chasers, unabashedly so. What do we focus on? What are the really most important things that we ought to keep our eye on?
That's a really good question. And I'm just going to warn you, I have like a little cheat sheet. I have a PhD in economics, but I can't remember a number. If you give me your phone number, I will forget it in 30 seconds. So I've got my little cheat sheet. So I'm going to talk about two things that aren't in the headlines but should be. And then I'll talk about two things that are in the headlines but not enough. Does that work? So two things that aren't in the headlines but should be: age discrimination. Age discrimination, age discrimination. It is so pervasive that we don't even notice it. I've heard several people in the last few hours say, "You look good for your age," which is a compliment, but it's also a statement that you won't look good later. I've heard employers say not so subtle things. And I know you're going to have an IBM story coming with one of your speakers about how we need to push out all of the people who are over a certain age. When we ask people, again, great research, when we ask people if they've seen or experienced age discrimination, 3/4 of people in 2020, I think this is over age 65, my notes aren't quite that good, but have seen age discrimination. And that's up during the pandemic. The pandemic, I think, flamed age discrimination. There were conversations about, you have to be under a certain age in order to get access to life support. There was conversations about how older people should just sacrifice themselves for the good of the economy and their grandchildren. So the age discrimination issue, I don't think is getting enough focus, and it's pervasive into everything else I work on because it's seen as not as important. The second is caregiving. So I call caregivers the invisible army because there's 41 million Americans who are taking care of people, giving 340 billion hours of unpaid care. So if we had to pay them, that would be almost $500 billion. And we expect people to do this without hardly any support. Often people are doing it quietly. Often people are juggling their work and their kids. I think half of all caregivers are actually in the labor force. I'm not seeing my note down here exactly the number. But that means that, you're taking care of somebody else. And this is not caring for kids. We talk about caregiving as caring for a loved one, a family member, not a child. So many people are caring for children and their aunt, their grandma, their mother. I'm using a lot of she words here because most caregivers are women. But let me be clear, there are caregivers who are men. There are caregivers who are millennials. We did a really great research on millennial family caregivers, and we put out some resources for higher ed about the caregivers who are trying to go to school while they're taking care of somebody else. So those are two things that I would really like you to be writing more headlines about. The other ones I think are still our healthcare system in the US is just a mess.
To use the exact term of art.
You can quote me on healthcare system is a mess. Some use I use more colorful words, but I'm on the record here today. The system is, we pay the most, we have the worst outcomes. I think that's been reported a lot. We still have 10% of people between 50 and 64 who are uninsured. And let's just be clear, we've done a lot to knock off the number of people who have uninsured since the Affordable Care Act. And the recent bills will do even more in that area. When we look at Hispanic, Latino, and Native Americans, it's 1 in 5 people in there between 50 and 64. So once you get Medicare age, most people are able to have some coverage. But there's still this hole for people who may have lost their job and used to have have an employer-based plan and who doesn't now. So those are just a few issues that I would like to see you guys write more about.
Okay. Another biggie that I think many of you will be writing about or covering is inflation. And I wanted to ask about, since it's also part of the issue leading up to the midterm, how is inflation in fact affecting people over 50, and what are the myths about what inflation is not doing?
What's it not doing?
I mean, like Social Security indexing,
okay.
Stuff like that.
So the good news is if you are on Social Security, you have an inflation indexed annuity, which means your monthly check goes up every year by the inflation. And last year it went up by 5.9%. We're waiting in October, so get your pens ready for the new number that'll come out. It's usually based on the July COLA, which was 9.1%. So we expect a pretty healthy COLA this year for Social Security benefits. Again, that's one piece of income. It's a very important piece because half the population, 1/4 of people on Social Security, that's all they've got, right? But inflation really eats away at all of the things that you can spend on, I think, by definition. But it's particularly harsh when it's healthcare inflation because you may be able to not, get a steak and eat beans, but it's really hard not to pay for the drugs that you need, which are also traditionally raising much faster than the CPI. I'll talk about the Inflation Reduction Act at some point, which you guys should also write about, which is going to be capping that going forward. But when you're on a fixed income, even if that fixed income rises with inflation, you're going to be more sensitive to all of these changes.
Okay. So knowing that you don't do states, I still want to ask you a state question, which is there's been a lot of action at the state level in fact, we have trouble keeping up with states passing things on everything from age discrimination to economic issues. Where's the action and what should we be looking at? Obviously everyone's going to look at their own state, but how do you keep up with 50 states and how do you suggest that journalists kind of we're supposed to be writing trend stories, right? But it's
Yeah.
very difficult to write trend stories when you've got 50 states, they're all doing different stuff. It's very hard to parse it.
Well, some of your reporters are from different states. And so a couple good things, again, because we have offices in 50 states, because we lobby in 50 states, we often have fact sheets for every state. So I just saw our Social Security fact sheets that we can give you about the average Social Security benefit in Maine, for instance, or Georgia. So those types of things can be incredibly helpful and useful to you. A couple good things that are going on in states. One, we were just talking, so you jogged my memory. The state of California has a California Plan on Aging that was set up by the governor and really done across the state. And they're putting some resources behind it that's really looking at all types of issues of aging. I see that as a huge model for what the rest of the country can do. And when I go to other countries, the states that have plans for an aging population do much better than the countries like ours that seems to have not noticed that we have an aging population and has no plan for it. The second thing is around age-friendly cities and communities. So this has been a rise. It started with the World Health Organization developing sort of a strategy around ways that cities and communities can think about becoming more age-friendly. And age-friendly is around transportation and housing and healthcare and social engagement. And there's 3 other ones that I always forget, but we can get back to you. And we have now over 400 cities, community, and now states. Maine is one, Colorado, California. It's hard to keep up with all the states that have adopted these plans based on their local conditions and what they need. We have small little cities like Macon-Bibb, Georgia, and then we have big cities like New York City that became age-friendly. This, to me, is getting people to talk about, if you set up a transportation system, you might want to make sure certain bus routes go to the hospital, right? Those things, unless you have kind of the intersection of different groups talking about these related issues, won't happen. And then the second thing, and this is kind of near and dear to my heart because I've worked on it for years, is for all of you that are freelance or any of you that don't have a large employer, you probably realize that you can't save easily through your paycheck for retirement, right? So half the country doesn't work for an employer that allows you to save for retirement. And that makes it really hard because if it's not automatically taken out, very few people just do it on their own. So the states have stepped in where the federal government has sort of not done anything for decades. And so we now have California, Connecticut, Illinois, Massachusetts, Oregon, and Washington all have active retirement plans where the state collects from employees as part of their tax revenue. For some states, down to very, very small businesses. Other states limit that. Every state has a little different flavor. We've also got 10 more states that have passed legislation to look at this or to plan for it or to create boards. And we have 30 states that are actively sort of considering. So this has been a huge push by AARP. It's much easier, well, it's easier and harder. It's easier to have one system for the entire US population. It is harder to pass a bill in the US Congress. So we are going state by state by state trying to get this done, but we are. And so you're going to have millions of people that are going to have a little bit more secure retirement because the states are realizing that if they don't, they're going to have to pay more in Medicaid, more in housing, more in food, all of these things. And so what's good for their workers is actually good for the state balance sheet as well.
Back to age discrimination. Is there any state that's doing a good job, or is there any legislation or any place that we can look to where things are going right on an issue that, as you said, during the pandemic, a bad situation seems to have gotten a lot worse?
So it's the federal, again, not a lawyer, economist, it's the federal legislation on age discrimination that we're working to try and change. So there was a case years ago that the Supreme Court changed the proof standards. Probably many of you have written on this and know more than I do, but changed the standard of proof that you have to prove that age was the primary factor in the employer's decision. And so we're trying to change that standard. I feel like I have heard some states trying to think through these issues, but I don't know off the top of my head.
Okay, we'll ask you more about that as time goes on, because as everybody knows, the news business is one of the most discriminatory, age discriminatory businesses, particularly TV, but all the rest of journalism as well. So lots of questions from us on that.
And we do, again, back to our cool research, we have done a lot to show how audiences don't like age discrimination in the media, that older women actually, in fact, want to see faces that look like them in their magazines that they read. And I do believe, at least from a model standpoint, I'm not going to say anything about the writers, but from a model standpoint, we are seeing Elon Musk's mom and more women who are coming forward in the beauty sector in particular. And we've been pushing that for years, that conversation.
So specifically on the beauty sector, two stories of note. One were all the stories in the New York Times about women who stopped dyeing their hair in the pandemic. Mm-hmm. And then the Canadian anchor, was it? Or who was fired for letting her hair go gray. Is this the start of a beautiful thing, or is this just a pandemic thing that's going to pass? Any predictions there?
I think the women are gorgeous, so I hope it's a beautiful thing. I do think culture changes slowly, and it changes most when we change ourselves. So, whether it's an act of rebellion or an embrace of self, I hope it continues.
Okay, I've got about 15 more questions, but let me throw it open to you. Can we have a mic?
Wait, you were supposed to ask me one question that I actually want you to ask me, if you don't mind, while you're passing out the mic. So the question is, what would I like you guys, or what's the stories that I hate?
Oh, yes, I was going to ask the myth question. I ask this in every fellowship of every big source. So all sources have stories that they just can't stand that journalists write, and the myths that journalists perpetuate and they wish they wouldn't. So forgive me for neglecting my very favorite question. What irritates you most?
I was so
Long
excited.
list.
I was so excited about this question. Yeah, I narrowed it to two things. So the first is, don't write Social Security is bankrupt. It is not going to be bankrupt. It's not like people stop paying their taxes on that day. So money is still coming into the Social Security program. So because it changes every year, in 2035, the current actuarial projection is that's the year all of the extra money that we've been saving for years to pay for the baby boomers will run out. And what's left, the taxes coming in, will still cover 76% of all benefits, okay? So it's not like it's bankrupt, you got nothing left. It is a shortfall. If we could use that word, I would be so happy. But by law, you have to match the money coming in with the benefits coming out. And so, talk about inflation cuts, people's benefits would be cut by 24%. Now that would be horrible. Most people can't afford a 24% cut in their Social Security check. There would be riots in the street. I do not think it'll get to that. But every time somebody writes that Social Security will be bankrupt, people don't believe in the system and that it won't be there at all for them. And it undermines solutions that could make the program better. So shortfall, not bankrupt. The second, and this is just the wonk in me, I call my job, I'm the chief wonk at AARP, is really the focus on process more than the policy itself. So if you read almost every story about the Inflation Reduction Act, it was Manchin, White House, Manchin, White House, Schumer, Manchin, Sinema, Manchin, House, Manchin. And it was nothing about actually what was in particularly the final bill, because the final bill is pretty awesome. We worked really hard. We had a huge celebration because these are things that we've been working on. I was on the floor for Part D in the US Senate when it passed, and that bill didn't have the ability to negotiate for prescription drugs. That will now happen because of this bill. Now, that's the one thing that people have talked about, but it's also going to cap out-of-pocket expenditures on drugs. It's going to hold drug cost increases to inflation. If pharmaceutical companies raise it more, then that money comes back to the Medicare program. It's going to fill the donut hole. It's going to make vaccines free. It's going to make insulin $35. So we have a whole blog that Laura will be happy to send you with all of the great things that are in this bill. And what drives me crazy is just people don't do the work to say, this is what the bill does that passed, rather than to say how many people voted for it and how many people and what's the drama of the Congress. So I hope all of you with the next few days will get into that juicy subject part that I love so much. So now you can ask me any question. I had to get that in.
Okay, well, actually, let me turn this over to you. Can you just say your name and your news outlet, please?
Yes, my name's Lauren Mapp. I'm a reporter for the San Diego Union Tribune covering caregiving and aging.
Awesome.
And I'm actually working on a story right now about the senior-friendly living communities initiative from AARP. I was just curious, how do you measure success as more programs come online, more cities, more states, et cetera? How are you showing that these programs are helping to the people that they're aimed to help, seniors in the community?
That's a really good and very tough question, because we moved from outcomes, how many places passed a law, to outputs, how many people's lives are better. And it's hard to measure, and particularly things like changing a city or even changing a law. So we like accessory dwelling units. These are like the little granny or nanny flats that you can put on your house, and we're trying to change the laws in cities, right? But what we want to measure is how many actually get built. And that can be like 5 years from now before we actually figure that out. So we do try to think hard. And we also really think hard about the design of the program to fit the needs of that community, because everyone is different, and populations want, even in senior housing, they want very different things. But as an organization, we are trying to shift towards that outcome rather than the output. I don't know if that totally answered your question, but it's something I'm actually literally struggling with right now.
Delaware Online and News Journal. And I'm not really sure how to exactly post this, but it's about 401ks. How does AARP see 401ks, since most people aren't able to save enough for them to be effective?
So
the
we
401k law, really.
Yeah, so we think 401ks are great if you have one, but we need to make sure everybody has a way to save. And so that's why we've been trying to pass these state laws to help workers who don't have access to a 401k. But to be clear, because the states are doing it and it's not the federal government, it's covered by the IRA standards. And so they're not as generous. Employers can't contribute in the same way a 401k does. Now, we have other issues with the 401k. We think that the money managers should be fiduciaries. We fought that battle, won that battle, lost the battle. But we worry about fees for workers. We worry about making sure that investments are good. We worry a lot about how do you take money out of a 401k, because right now it's sort of like you figure it out for the next 60 years. We worry a lot about how inflation and bad asset returns like we're having right now can affect people's need for money. So we think about the whole retirement savings system. And I should have said this at the beginning, we also take a life course approach. So we also think about how do we get younger people into saving, although the news is pretty good on that from what I've seen. The surveys are that younger people are actually even saving more, like young X's and millennials are actually saving more than more millennials are saving more than X's or baby boomers even did at their own ages. So we think 401k is good, needs to be better, but everybody needs that kind of automatic saving and protection.
I'm Susan Tompor with the Detroit Free Press on USA Today. Hi, thank you. This is sort of a follow-up on the 401k, but I've had a conversation with at least two people recently who say, that three-legged stool, personal savings, Social Security, and pension, that one of the legs is gone for a lot of people in terms of the pension. I know some people at Ford, or Chrysler, if they were hired after 2012, they don't have a pension. Where does that third leg come in? Does it simply mean that people are going to have to work longer? I mean, what do you think is going to support retirement for a lot of people who don't have a pension?
So I'll take a step back. The three-legged stool, how many people have heard of this? We retirement monks talk about the three-legged stool. So some of you had it. It's the ability that you can rest comfortably in retirement if you have Social Security, a pension, and your own personal savings, right? That's the ideal. You are sturdy on a three-legged stool. Unfortunately, all three legs have problems. As Susan mentioned, very few people have pensions anymore. If you don't work for the government or a union, you are unlikely to have pensions. Still in those industries, and there's some funding issues about both of those, but I'm not going to go into that depth. But pensions are either rare or somewhat often at risk. Not everywhere. Some of them were fairly well funded. The other leg is 401ks, and so that's the answer that I just gave. Half of the population doesn't have the ability to save through their employer. So if you have that leg and you saved consistently and you never withdraw the money because you had a medical issue or lost your job or needed to tap money even at a really high expensive because you pay all the taxes, then if you had a good work career with a good employer, you can actually have some money and you can have that stool. If you don't, many people don't have that leg. And then there's Social Security, which everybody say it is not going bankrupt, but has a long-term funding problem. And so, what we're asking for people is to look at their future and figure it out themselves. And so the amount of risk that people face, and there's this, I think, anxiety that many of us face who are not in a sensible three-legged stool retirement system, that's the anxiety that many of your readers are tapping into.
Oh, sorry.
Wait till
sorry.
you get done.
Okay. Go ahead.
I'm Ann Tergeson at the Wall Street Journal.
Here,
And yeah, I want to ask you another question later. But speaking of the three-legged stool, do you guys have a sense for what might happen with Social Security in terms of what kind of, for a while I was thinking, well, it would be kind of like 1984 or the 1980s where there'd be some bipartisan commission and there'd be, benefit cuts through some couple different mechanisms. But now I'm wondering, the Democrats are talking about enhancing Social Security. I don't know. I'm just wondering what you guys think in terms of the outlook for how Social Security is going to be shored up.
So I'm going to be careful because I don't have a crystal ball and I don't want to be quoted as saying this is going to happen. So let me tell you what's happened in the past, which Susan, you already know, which is it was a crisis in 1994. Social Security was about not go bankrupt, but not be able to pay full benefits. And so Congress acted, and they acted in a couple ways. They raised the payroll tax, and then they raised the retirement age. But they did the retirement age way off into the future. It was a bipartisan deal, but it was done really with a ticking clock. They had to do something quickly. Now, Congress doesn't always do things without a ticking clock. But and I had hoped we would be addressing this years ago, because the longer you wait, the bigger the problem and the fewer solutions that you have. So when I worked in the Senate Aging Committee, we put out a report that minor tweaks needed to be done to Social Security, because at that point there was quite a few options. As we get closer to 2035, 2035 or 2034, it keeps changing every year. 2035, which by the way is the year I turned 65, so I actually care about this. As we get closer to that, the number of choices that we have and the harder the decisions become. We have now, I'm just going to describe it because we really work hard to be nonpartisan. There are bills in Congress that are no benefit cuts and benefit increases. In fact, and only tax increases, right? So there's only two ways you can save Social Security. You can cut benefits or you can raise taxes. You could also bring more money into the system, but usually that has to be done through taxes. So there are a number of proposals that are only raising the taxes. I guess that was that. There are a number of bills that are only cutting benefits. And there's a lot of commissions that have happened that are some mix of those. So I think it'll be one of those three things, depending on who is in charge. Social Security, and you'll know this when you go to the Senate, is sort of a privileged bill. It takes a 60-vote threshold in order to make those changes. There is a talk among some members to change that. We would be very concerned about that. There's a talk about some members to look at it every year or every 5 years rather than try and set it on a long-term financially stable path. The Social Security actuaries look at a 75-year projection, which is a really long time, and it's really hard to make the type of choices at this point that is going to keep it on a sustainable path for 75 years. If it was sustainable another 30 years, that would still, I think, help people who are now looking in their 50s at not knowing what their benefits will be when they hit 65. One other important Social Security fact for older workers is the earlier you take it, the less you get for life. That's also really, really important because a lot of people have to take it right when they're first able and then get less. And the average check is only $1,668 per month. Half the people get less than that. That's the median.
Debra, hi. I'm Bill Cole with the Associated Press. You mentioned that you were just in New Zealand, and I'm curious what lessons you brought back from New Zealand. If I'm not mistaken, U.S. life expectancy has trailed New Zealand's by a good 3 years, give or take. I don't know what the latest figures are, but we've always lagged behind them. And I'm wondering, are there lessons that you learned from the New Zealanders, from the Kiwis, that can help us and that we can, take on here?
Sure. Yeah, honestly, this is my favorite part of my job. Every year as part of our international journal, we actually put together an international journal that highlights lessons from different countries. And so that's why I was in New Zealand. I'm still a little jet lagged, but there was two pieces that I took for it. It's a small country. It's 5 million people. When I told them how big AARP was, everybody was like, oh, wow. So they were impressed. Lovely people, great food, great coffee, great wine. But what I took from it is one thing. They had like a plan for this, a plan for that, a plan for caregiving, a plan for long-term care, a plan for their older workforces. I'm jealous, again, back to California and some of these places. We don't have a plan for this. It's not like we didn't see the baby boomers coming. It shouldn't be a shock to us that we have an aging population. And they were all integrated. Again, it's a small country. I think we met every staffer who works on these issues and every minister while we were there. The second is they take very seriously their Maori population. And so they just did a health reform where they took 20 plus health districts, made that into one, but also had a separate Maori Health Authority. So we visited Maori nursing home. We visited places at the community levels where they were developing their services. The Maori people take health in a broader way. It's not just about your physical health, it's about the health of your spirit, your community, your land. And so it's a more holistic approach. And so to even have a health system that recognizes that, I was telling my table, I grew up in the Pacific Northwest. My high school is next to a reservation. We forget we have an indigenous population. They take it very seriously. All over the country, people are learning and speaking. Even Pakahai, the white population, are learning to speak Maori. But the coolest thing was a Kiwi coffin club where people decorate their own coffins that I saw.
I'm terrified listening to you.
Why?
No, because you're saying, we have no plan for aging, and yet I keep reading things about reframing aging, like advertising it instead of addressing it. So your three-legged stool thing, Karen Michelle, lifer freelancer for NPR. This three-legged stool thing, one of the pieces of homework we had said, and please correct me if this is wrong, that only 20% of the population receives Social Security, of the people who are eligible. 1/5 of the population. Is that true?
That can't be right.
I've got the piece of paper. I'll show you.
We'll get you a better number. It can't.
Okay. I hope not.
That rely on it solely. Probably that sounds right.
Is that what it is? Was that what it was?
So there's maybe 20% or 1/4 who only have Social Security.
Okay.
There's about another quarter that it's most of their income.
Okay.
So if we think about the other two legs, that pension, that's great for half the population, but most people don't have it.
Okay. So, question is, during the pandemic, more people have A, been unemployed, or B, self-unemployed, namely kind of a gig economy or freelance. Given the increased number of people in that who have limited access to Social Security funds, definitely less than that average, no pension and limited savings, what is being done to address a security network, for want of a better term, for the people who don't meet any of the stool legs?
Not enough. Not enough. There's more and more of these people. And I know you're going to have Beth Truesdale, and there's a new book coming out over time. You have the two speakers coming this week. One of the chapters is really stunning that I hope you guys will look into. It's an interview with workers who work in hospitality. So it's restaurant workers. And it was really fascinating. They also did an analysis that if you worked minimum wage all your life, and it's assuming you worked minimum wage every day all your life, which most minimum wage workers, they work some and then they lose their job, right? But if you did, in order to make basic ends meet, you would have to work an additional 30 hours every year till you die. Just because your Social Security check wouldn't be enough to pay. So I think they call that chapter "Dying with Your Boots On," but the stories were really, really incredible, and that's the problem. We have SSI for low-income people, which provides very low amounts of income. It gets you Medicaid, which is pretty generous health care. That's the real benefit, and most importantly, it has long-term care benefits as well. But we don't do enough.
Which covers this age spectrum at this point, who don't pay into the system, who don't get anything back, and the entire arts economy. And there are many very prominent elderly artists who live in a space and work in a space the size of this table.
Yeah.
There's no support. But people make millions of dollars selling their work after they're kaput. So I'm hoping AARP looks into some of these other sectors. And thank you very much for the work you've been doing.
Hi, I'm Laura Poutre. I write for Industry Week. We cover the business of manufacturing, and we also cover a lot of workforce and labor issues. And I was just wondering if you talked about, how prevalent age discrimination is. I'm wondering if there are any companies that you can think of that are doing innovative things or doing things right, and have really benefited from their older workforce.
Thank you for that. And that's a really great question. So I'm going to answer two things. One, what we're doing to try and get more great companies, but one that's particular probably to your industry. So I think it was BMW in the Carolinas, I'm not sure which, redid their production system to be more ergonomic to help their older workers. And what they found is actually productivity for everybody increased. The number of injuries went down. It's like this great case study, which I think is true of so many things when we make things accessible for the people that need it, it's actually good for everybody else. We at AARP and my team in particular have been trying to change the conversation about the need for employers to think about the multi-generational workforce. We used to talk to them about older workers, and we didn't get as much enthusiasm. So now we talk about the multi-generational workforce, and we have over 75 companies that we've been working with. This is in collaboration with the World Economic Forum and the OECD on a whole bunch of research showing that multi-generational workforces are actually more productive. Our research shows that people want to work with different generations. And we talk about the longevity economy. So it's the share of the US marketplace that is being fueled by people over age 50, both directly and indirectly. Gene Axios will probably talk about this. We're about to do one for the whole globe. But 8.3 trillion, or 40% of GDP, can be attributed to people over age 50. And so when we talk to employers, we say, shouldn't your workforce match your consumer base? Don't you want salespeople that can sell to the people that are buying your products? Don't you want to look at your most valuable assets in terms of knowledge and experience, contacts, all of those things? And then we talk to them about the issues that are being faced by the multi-generational workforce. Caregiving, which we've talked a lot about, which is hitting people at every age. Flexibility, younger workers and older workers want flexibility. We talked to them about adding age into their DEI policies, giving training on age discrimination, looking at the ESGs that they are doing, and even creating CERGs and other things for their older population, having age-blind hiring. We've got a whole list of great ideas. But we're trying to create employers that are sort of champions on this. And actually, we found a lot of employers that were doing great things. So we highlight those employers that are. So we're happy to put you in touch with some.
Around manufacturing, like we write about companies a lot, manufacturing companies, like that companies that are working with you or like a contact. Who would I reach out to at AARP for that?
Laura's going to be the contact, I think, for all of you.
Okay.
Because we're a big organization, and you may ask a question that you think I would answer, but it could go to one of the other parts of the organization. Laura and her team are the best ways to handle it, and she'll make sure.
Thanks.
Deb, is your schedule? How are you doing?
I can use another splash of water if anybody can find one, but other than that, I'm good.
Hi, Timmons, and I work at the New Hampshire Bulletin. I cover state policy, the legislature. We've seen billions of dollars come in pandemic aid since the pandemic. It's really been directed toward small business people, restaurant owners, things like this. We're very much focused on keeping young people in the state. Yeah, we're the second oldest state, I think, at the moment in the country. Have you seen other states doing anything with that money that supports that population, the older population, or these livable cities, or anything on that front that could be something that we might look at here, New Hampshire?
I honestly don't have a great answer for you because I haven't looked how those are filling out state by state. So my apologies. Like, I don't have any good quips.
I was just wondering, at what age do you find age discrimination starts to impact workers? Is it happening earlier and earlier?
So it depends on what you do, right? If you're in Silicon Valley, being in your 30s we've heard the Age Discrimination ADEA, Age Discrimination and Employment Act, starts at age 40. So by law, you can't use ages after 40. But, and we've got a whole litigation team. We've seen things like ads of, new college graduates should apply for this job, right? There's code in many job placements that sort of push out older workers, new digital native, things like that can be signals, but the actual law starts at 40. And just to be clear, it also intersects with the disabilities laws as well, because oftentimes our health declines as we age, and people have other health issues. And so again, proving what is age, what is disability, and what is just employment issues is hard to tear apart.
Pretty much on why is it so hard to pass legislation when most of these lawmakers are older citizens? I mean, I have my own idea, right? Maybe they're privileged people and they will not encounter the necessity of having or they have their three-legged position already in place. But is there any other influence, any other situation happening in the market that makes it so hard to pass legislation to have, in place to meet the needs of the elder citizens in the U.S.?
Yeah, I ran the Senate Aging Committee for 5 years, where we introduced tons of pieces of bills, some of which little ones eventually passed. I would have liked us to be on the Senate floor every week. I think I'll give 2 reasons. One, sometimes these aren't urgent. They're important, but they're not urgent, and Congress deals with urgent. Right now they're trying to fund the government. 2 is they're expensive. Thank you so much. So, small changes to these programs, Medicare, Medicaid, Social Security, add up into really big numbers, and so that makes it hard in an era where many people want to have fiscal discipline. Because if you're going to spend money, then where are you going to get that money from? And then you have to make the choices of this program versus that program. And it bothers me a lot that it gets pitted against things like, well, we can either pay for Social Security or we can pay for schools, right? It's not that clear of a choice, right? We are the wealthiest country in the world. And yet when I go to other places, I see better quality healthcare. I see, everybody has healthcare. It's, we are an outsider in that way. We have one of the, it's not the least generous. I think we're like number 40 in how strong our retirement system is. The programs that we have are creaky. They have huge holes in them, which rarely get filled. I mean, as I said, the prescription drug bill got added on Medicare, but there is no long-term care program. So if people need more than to go to a hospital, but they need care for longer parts of their life, we don't have a program that pays for that unless you're really poor and get on Medicaid. So we need structural change, and we need take these issues seriously. And they are expensive, let me just be clear.
Your daily news in Maine, and I think we beat New Hampshire on the highest age.
I was thinking Maine was older.
Pardon?
I was thinking Maine was older.
Yeah, well, the median age, the highest median age. Yeah. So in Maine and a lot of rural areas of the country, there's a big issue with getting broadband out to seniors. In rural areas, giving them a digital education, there's a big divide. What is AARP doing to try to bring more attention to this? And do you know if there are any, I know there's some funding in some of the recent plans the government put through, but the funding and actually putting it to work properly are two different things.
Yeah, thank you for asking that, because we're actually doing a good amount here. So there was a bunch of funding in a couple bills ago that Congress passed, specifically for broadband. AARP has been activating every state to make sure that they apply for in our plans. And if I remember, I don't have the exact numbers, but the share of people over age 50 who are applying for it, because we've been pushing out back through our communications channel that, again, we have print communications so that people can have it, that they should be applying for these extra funds. So the people over age 50 are actually half-ish. Can't remember what Nancy Lamont said. So we've been really active in getting the money to the older adult population. Second, we acquired another small nonprofit called OATS, Older Adult Technology Services, OATS, and they do training for people on how to use technology. It's a really great thing that I hope all of you guys sort of push out, but classes and learning how to use smartphones, how to do telemedicine, all of those things. So we both access and training we provide.
Lauren?
Thank you. Lauren Mapp again, San Diego Union Tribune. So in our county, we have a lot of programs that address aging. We're about to announce our inaugural Chief Geriatric Health Officer. In the state of California, we have the Master Plan on Aging. But I'm always looking to see who else in the country is doing something better when it comes to aging. Are there particular counties or particular states that you kind of look at as being an example for addressing the older population?
Good question. Remember, I told you I don't do states, so I'm not going to compete amongst the states. I feel like what I'm most proud of, and I think California is actually doing a lot. First of all, you have this master plan that was set up by the government with both resources and multiple departments behind it. California is also California Secure Choice, which has been rolling out like gangbusters to cover workers who don't have retirement systems. But you're a big state. So sometimes some of the innovation in smaller states can also be good to study, because even though you're a big state, you have rural areas. I know Maine and New Hampshire, being the oldest states, often do really creative things around transportation, ride sharing. We have in our Livable Communities website a whole list of great things that different states are doing. So I guess I'd push you to that resource, because it kind of depends on what the issue that you're particularly interested in. We also started a few years ago giving small grants across the country to different local communities to do things. So everything from, adjusting a sidewalk so it's easier across an important area to we've created fitness parks all over the country. So we often do sort of local targeted investments that can help a community. But I don't think I answered your question perfectly, but we can get you more resources.
Deb, I have a last question for you. It has to do with hearts and minds. And I know you're the policy wonk, but You know, the pandemic in some ways has exposed our level of not caring. It's a values problem, right? We've just decided that it's okay that 15,000 people are going to die a month, and well, most of them are older, or that we've lost 1 million citizens, which we don't really talk about. Most of them were older. What do you think actually is effective, has worked and not worked in changing people's attitude or their perception of the value of elders or seniors, and what actually moves hearts and minds in your experience?
I don't have a great answer at my level because I don't feel like we've gotten my issues to be as hot and as important as I want them. But I do think two things. On a personal level, it's families. When you are experiencing, oh my God, my mom broke her hip and I live across country and now I've got to take care of her. And oh my, wait, what do you mean? I have to pay out of pocket for $500 a day in order to have somebody watch her. Like the realization of how broken our system is happening family by family. I'll say that translated a little bit into why the Inflation Reduction Act passed. So I know I told you not the drama about Manchin, but Senator Manchin went to an AARP town hall, and we delivered 30,000 petitions from his constituents in the state of West Virginia, and 30,000 is a good percentage of them, of how they were suffering from high drug price. So we told the stories of 30,000 people, and we said, listen, you know, this is really important. So we took that individual and raised it up, and he committed in front of his constituents in the 30,000 piles of paper that he was going to do something about it. That's how the Inflation Reduction Act passed, is he said, I'm going to do something on drug costs. If that's the only thing we do, I'm okay with that. That's what's going to happen. And other things got added to it. But again, it goes to people's personal experience. But I don't want people to personally experience pain, suffering, and falling through the cracks. I would like their experience to be one of a three-legged comfortable stool that everybody gets to sit on in retirement. And I don't know when the suffering on all of these issues that I work for is going to get enough to really move us into the world of we've solved all the problems. But I feel like we are at least in a world where states are being innovators, where Washington is stuck, and where local officials are trying to solve the problems. And that gives me a lot of hope.
Well, thank you very much. Thanks for making time for
Sure.
us. And thanks for being with us. So everybody, a couple of announcements. Alyssa, tell us about two things. One is the Clear app, and second is getting into the Dirksen building tomorrow, just so we all get there.
More announcements on that for you. So first,